for Zoom. Okay. Here we are good.
Okay, thank you.
Okay.
Hello, my friend.
Hello.
Morning, Ann.
Hi, George. Let me see here.
So right now we're missing Victoria and Chris.
Hey, Donna, I'll make you host. Can you make
Okay.
me, go ahead and make me a co-host so that I'll be able to get back on, I think if needed. Great, thank you.
You're welcome.
Hi, Donna. This is Chris.
Hi, Chris.
Okay, I'm coming in on the video.
Okay.
But feel free to go ahead and start whenever you want.
We don't have Victoria yet.
Ah, okay.
I'm checking in with her. So Ann, I haven't heard from her. I don't know if you want to just start and we'll catch her up.
As I recall, she joined us late last time too.
Okay. So we are recording this on YouTube, and I am recording this for my records. And I'm sharing the draft state plan that Chris developed earlier or last month.
Okay, so what I have on the agenda for today is that we were going to discuss some specific brain injury related impacts as a result of COVID. And we were going to sort of provide some preliminary feedback on the goals and objectives that we have. And we were going to talk about in a little bit more detail how we might go about handling this conversation at the council meeting. I also think that we've got to talk some today about how we're going to get public input into this plan, because the public is broader than just the council. And there are, some things that I recognize haven't been addressed in the draft that we have that may be necessary to discuss in a broader community. So, I'll start because I had said that I was going to do some of the COVID related stuff. We had our keynote speaker at our annual conferences was Gordon Horn, and Gordon talked about the COVID related impact on the brain injury community. And so, he had some stuff in there that was very specific about, some of the central nervous system signs, some of the peripheral nervous system things, some of the neurological and neurocognitive issues that we've seen, including, various encephalopathies, encephalitis issues, some cognitive impairment, some, behavioral health impairment that could be neuropsychological. We're not entirely sure. It talked a little bit about some of the COVID-related vulnerability. So I'm not entirely sure, how much we'd like to discuss that, or if we just want to reference it in this document in some way, because I think there's so much that's still coming out about it, that, it may be that how we address COVID in this plan is really just to continue to assess the impact and watch the developments to address long-term effects, long-term neurocognitive and neuropsychological effects related to COVID. So to have a very, very broad thing that just sort of gives it a nod in the plan, and then we perhaps just move forward from there. So I don't know if anybody wants to talk a little bit more. I don't know if there are, Chris, you had any thoughts about how much COVID related stuff that you wanted in here. So I'm just sort of opening it up. I'm happy to provide folks, if you would like, I could provide you a copy of the PowerPoint that Gordon did for us for the conference, and you could see he's taken some a variety of different sort of research and including risk factors and vulnerabilities and what actually physiologically happens in a COVID attack on the brain. So I'm happy to provide that to you guys for a little bit more background if you'd like it. But our question today really is, how would we like to address COVID in the state plan? Let's keep our eye on it sort of thing, and where would that go?
I'd like to just second the importance of referencing COVID as a really pertinent situational factor, and one that is longitudinal. So it's not, it's not going away. This would impact us through the duration of the plan. I also wanted to underscore the impact of COVID on caregivers. And this is a line of inquiry that Dr. O'Donoghue and I are following. We've just completed a pretty comprehensive literature review. At present, there are no studies, no published studies on the impact of COVID on caregivers of brain injury, but there are 3 published studies on caregivers of dementia, of individuals with dementia. And George may be familiar with some of those too. And there are perhaps some connections there too. So just wanted to underscore the heightened impact on caregivers, and that might be a connection that we make as well.
Kara, I think that is both what Ann brought up and then what you added about the caregivers. That seems very important to me.
I was having this conversation with someone the other day, and they were talking about, how difficult it is to work with some of these survivors on a, who are in residential programs on a day-to-day, long-term basis. And the fact that at the end of their shift, they can go home and they're exhausted and tapped out. And, caregivers that have someone who is difficult are lonely and struggling and isolated. And so I think that probably, under goal 1, it seems to be the most appropriate place at this point to have a nod to something related to COVID, and whether that is, to continue to monitor and investigate the impact of COVID-19 on, we have a couple of different issues here. We have the general public, we have the impact on individuals with brain injuries, and we have the impact on caregivers. So all 3 of those things sort of have to be monitored in some way. And, we can massage the language a little bit, but I think if we can sort of agree on those three different groups and including something probably there in goal 1 about services and supports. It doesn't completely fit because that goal says assure all Virginians with brain injury have the services and supports. So that sort of makes a statement that while we're monitoring the general public, we're just waiting for them to develop a brain injury related to COVID. You know what I mean? Sort of, so we'll have to play around with that, I think, and maybe play around with the wording. But if we can get some, I think, general consensus on that, we can move that along. Would you agree, Chris?
Well, first, the two things that I wanted to, one was to say and one to ask is, certainly we're not wedded to these goals in the way that they're written. I put this together for you all as purely something to have something to react to and to play with. So don't feel wedded to those goals. I am curious what George and Kara think, do we want to try anything a little bit more assertive than monitor? Is there anything in particular more that you all, based on your experiences, George with caregivers, Kara, in light of what you were just saying, is there anything that you suggest that we add in terms of action? And Anne, I'm so glad you brought this up.
So I'll jump in. So I think you're right that we need something, and I think goal 1 as it stands appears to be the most appropriate place for that. In terms of, I think there's a couple of different issues here. One is the neurological impact of COVID over the longer term, which we don't really know very much about. And the other is the social isolation aspect of the pandemic. But that looks like it's going to be over more or less by the time the plan is ready. So
except for those of us who've had an anaphylactic reaction to food.
Yeah.
That was great
Right.
news
Okay.
this morning. I'm anaphylactic to shellfish.
So, yeah, there's still going to be vulnerable populations related to COVID. So, I think it needs a bit of work, but I think you're on the right track with the monitoring, at least because looking forward, say a year from now, what is going to be the main impact of COVID that we're still experiencing? It's not going to be so much the social isolation and the current difficulties that we're seeing. It's going to be those longer term impacts of the disease. But hopefully by then we wouldn't have community spread, and we wouldn't have the kind of we wouldn't have ongoing large case numbers. So.
George, as you were talking. Oh, go ahead, finish. I'm sorry.
I was just going to say, not to rule out, the possibility of another pathogen coming and creating the same sort of situation in the future.
As you were talking, one of the things that I was reflecting on is that the timing of this makes deciding what action verb we're going to use difficult, because right now we're still in the monitoring and learning stage, and we don't know what it's going to look like in 5 years. So we do have to have, some sort of word that sort of covers a very, what's the word I'm looking for? Nebulous sort of continuum. You know what I mean? So,
well, I'm wondering, and I want to make sure Kara gets the opportunity to talk too. If are we talking about then, looking at or as part of the monitoring is at both the research that comes out of this, the lessons learned, and adding in a preparation, both a response and a preparation. I don't know.
Yeah, I would agree with that.
Maybe it's so specific that maybe it needs a codicil or a special little sub goal of its own, rather than trying to bring it under one of the broader goals. Stunned silence.
I'm just jotting down some of the words that come to me as people talk. So, Carrie, you were going to say something. You started off with I think you said I agree, and then you muted yourself back. So I didn't know if you had anything to add.
No, I wanted to endorse what Chris had recommended, that, we're monitoring in conjunction with the popular literature, but also the evidence-based published studies, which, takes so long to actually get published. So sometimes your stuff is is the more popular press things.
Yep. So we could probably do something like monitor and develop as indicated. Anybody got anything else to say on the COVID thing? Would you guys like me to send you Gordon's PowerPoint? Do you have some interest in that? Okay. Let's see here. I'm going to do that right now. I'm going to attach it to the email that Donna just sent us a few moments ago.
That doesn't include Chris on it because I had spoken to her earlier. So you might want to add her.
Okay.
Thank you, Anne.
You're welcome. He also, we did also record that session, so that may be something that we could make available to folks at some point, if they wanted to look at that. But I've just sent you a copy of the PowerPoint that we had. The next thing that we had on the list, or the two other remaining agenda items that we had, were to sort of begin providing some feedback about this state plan, and also to begin discussing how we're going to do this at the January meeting. And I would like to add, beginning to have a conversation about how we're going to get broader community input. So I don't know, does anybody have a strong feeling which way you want to go, one way or the other? Okay, well then, we had begun, I think that let's talk a little bit about how we want to discuss this at the January meeting, because that may impact a little bit, what we decide to do about the goals and objectives here. We've been thinking about needing to prepare for the January meeting. We'll have one more call between now and then. And given the restrictions that we have as a public body and a public meeting, and not, being able to do things like, breakout rooms and that sort of stuff, I don't know the best way to facilitate the conversation. I do think that anything that we want, they obviously need to have a chance to review these sorts of things, review this document before the meeting. And there has to be some context provided to them about this. I don't know. We've talked about, providing other documents or reviewing other documents. One being, the needs and resources assessment that comes out of the BIAV INR data. So we would need to identify any other information that could provide that context to them. And we'll need to set them up for how we're going to discuss this at the January meeting. So that's part one. We need to identify any additional materials and set them up for how we're going to discuss this. So if we could take a couple of minutes and address those two issues, then we'll come back to the issue of broader community input. So I'm watching the time and trying to keep us on task and make sure we get at least a discussion about all of this in a little bit of time. So I think that we had, some sorts of conversations about, were there technology tools that could be used as part of this? And I don't know where anybody has landed, or if you guys have heard anything, or, if you've got any great ideas for how we facilitate this conversation, because it needs to be a conversation. We could stand up, it's not stand up there in front of everybody, but we could sit in front of our camera and go over this, but that doesn't generate conversation. So that's the tricky part. And I'm really curious about any ideas, whether or not you think they're great. We're in the brainstorming, and brainstorming means every idea gets considered, because we got to figure this out, So please feel free to share any thoughts that you have.
Did we find out whether or not the polling feature will work when we're broadcasting?
Yes, it will. We confirmed that.
Mm-hmm. I mean, that might be an opportunity. There might be an opportunity there. For instance, we might, I'm just kind of making this up, but we might have a question like, which of the 5 goals are you most, do you feel most confident about as is? Or which of the 5 goals do you feel merits the most conversation and tweaking? There just might be some ways that we can use the polling feature to focus the discussion. I mean, it's real absent. There are other technologies we could utilize, but they could be really tricky and could create access barriers as well that I would be concerned about. I mean, it would take us, we'd have to send out instructions ahead of time, and I just don't know. I think the cost, the psychological cost, it could be too steep for some of our members, and I think we want to avoid that.
I think the polling feature is a great idea.
Yeah, I'd agree with Kara that using the polling to narrow the discussion somehow is good. I mean, the difficulties with the polls is they have to be set up before you start the meeting, and so you kind of have to know where you're going to focus, where we want to focus the meeting in order to use the polls effectively. But in terms of the technology, I absolutely agree that asking other people to try and use something new is going to be virtually impossible in that setting. So having, say, Donna or maybe a third person who's actually a scribe using a Word document that, we can throw up what people are saying so that everybody gets a chance to actually see it in front of them, or if there's another way to make that even more accessible, maybe periodically stopping and having somebody read what's been thrown up on that board so that everybody can get access to it. But that I think that might help facilitate a conversation if people's ideas are being just stuck up and everybody can take those in and respond as they choose.
I think one of the concerns that I have is that, there's a lot of good stuff in there, and there's a lot of stuff to do. And I don't know that we can, in one 3-hour meeting, give adequate attention to all 5 things that are in there. So that's one of my concerns. So I don't know if we need to think about, spreading this out over 2, because if we want people to feel heard, particularly relative to number 1, there could be a lot of comment, and I'd hate to, for the sake of getting through it in one meeting, say, okay, that's great, we've heard enough, we've got to move on, and not allowing people to feel heard. So I'm trying to figure out sort of how to balance that too, in terms of how we present the information. And I'm curious as to what you guys think about that statement.
Yes, I'd agree with that. And I mean, I'd like to say what a great job you've done so far, Chris. I think this is a really great start, but I do think it needs a fair bit of tweaking maybe before we show the full council. And I'm not sure maybe that we can get that done in the short period that remains between now and then. So I don't know what you think about that, but maybe we just need to be thinking about reporting where we are in the process rather than and providing something to give for the council to give feedback over the next month or two, and then maybe revisiting it in a bigger session in June. I know that would push our timeline back, but I feel like this is a great start, but there's a fair bit of work to do on it.
You know, it's interesting you say that George. I mean, I agree. I've done my thing. I've got some comments, as you might imagine. But I'm wondering, I think that the goal areas are a great place to start. And if we just approach the January meeting with, when you hear these goals, what comes to your mind? And just let everybody sort of have a conversation about it. And then we get some, verification of things that may already be in there, and some indication of things that we've not thought of. And that leaves the conversation very open-ended on the front side. And when we come back with something that's more detailed, it demonstrates that we've heard the input.
Yeah, I couldn't agree more. I think that there's a content heaviness to this, which is necessary, but may stifle conversation, because we may actually get caught up in unpacking some of the content pieces. Like there's a fair share of information in here that I don't understand because it's not my professional experience, right? So I could imagine some people saying like, well, what does it mean to build a relationship with a Medicaid MCO? Why is that important? And then we could go down like, that line of thinking, and it could take time, right? So I like this idea of really concentrating our time and our discussion at the goal level. And then we could later map what comes out of the conversation to what is in this document. And then it shows the alignment between what the council says and what the professional staff have already written.
Mm-hmm. Mm-hmm.
I love the direction. Go.
I was just gonna say, what's your reaction to that, Chris?
I love the direction you guys are going on this, and I know that I'm the one that set the time frame in the agenda, and if this pushes that out a little bit further because the process is so rich and good and valuable, then yes, let's do that. I think there's a lot of value to what you all are saying, and I'm all for it. So keep going.
Well, what I'm thinking is it would be relatively easy to take this conversation in a very general way at the council meeting, and then taking what we hear and sending that out to the broader community as part of a survey. When we asked the Brain Injury Council about, goal number 1, this is what they said. What do you think? We could do that as a multiple choice thing. We could do this as a, but we could figure out how to set that up so we guide the broader community into a conversation that's already taking some shape. And then we provide a document to the council that not only has theirs, but we can say to them, we used what we heard from you to shape the survey that went out to the broader community. And this is what they endorsed of your conversation. That sort of approach. How does that sound?
I think that sounds good. In terms of I think we're juggling a few things. We've got the council input, we've got the public input, and then we're going to need the council to review the final plan, which would include both their input and the public input. And so, if we're giving the council January's meeting to provide their input, are we taking so for example, what we did with the dementia state plan is we did not take it to the public for input until we had a pretty final draft, and then incorporated what they had. So, for example, the commission discussed it in March at their first quarter meeting, and then we had the public comment periods over the next 3 months and brought back a final draft to the commission that included their input. But it was already pretty well written by the time it went to the public for comment.
And George, talk a little bit about what you heard from the public and then what impact that had on the plan. I mean, I know that that's how lots of public comment is done. I think I'm always sort of biased on let's get their input on the front end rather than, give them something for them to react to. So I'd really like to hear more if you could share that about, how that process, what sort of feedback you got, and then how that impacted the actual final plan that went to the commission.
Sure.
Does that make sense?
Yeah, absolutely. And I agree with you. Getting public input at the front end is super helpful. But I mean, the idea is great, but I think you're opening it up to getting lots of left field stuff that maybe is not super helpful for what we're trying to do. What we did was, we partnered with the Alzheimer's Association to offer 5 public listening sessions around the Commonwealth, as well as opening it up for written and verbal comment to me that was advertised through the Alzheimer's Association and on our website. So I'd say all told, there are about 120 people, members of the public and service providers, that came to those public listening sessions. And I think it was, in the end, the document didn't change dramatically, but there were some small tweaks that we did make as a result of the public comment. And that was mainly based on people's personal experiences. So often there would be some specific incident that a person living with dementia or a caregiver had talked about that made us change the language or revisit one of the sub goals. But we didn't make any changes to the broad design of the plan as a result of the public comment.
Would that be something that we'd want to ask the council about their preference for the process at the meeting? Do we want to ask them, would you prefer to have public input, when this is still, when it's, I'm trying to figure out how to say what I'm saying. To ask the council if they would like to have public input that may be, more broad or specific to a draft plan.
And something I'm wondering, we did just survey the public prior to the priorities letter. I'm trying
That's
to
true.
remember how much input. Do you remember how many? I can go back and look, but do you remember how many people responded to that?
I can absolutely go back into Constant Contact and find that actual survey. So let me make myself a note to do that. It was somewhere in the neighborhood of around 100 people, I think.
Yeah, I that's what I was thinking too. To me, it's George in describing the process that they use for their plan. It's not just maybe front end or back end, but it's the survey data versus the public listening sessions, which intrigues me. Kara, I'm curious your thoughts.
Yeah, so you're asking a more qualitative researcher, so there's a bias there. certainly public listening sessions take much more time and coordination, and there's a heavy load involved in looking at those data and extrapolating the themes. But I think sometimes the process of offering those sessions is deeply, deeply meaningful to those who participate, because it provides that opportunity for them to voice their lived experience in a way that is just more difficult in a survey. You know, I think surveys are great for quick perception, satisfaction, as a check. So if we wanted to sort of check individual satisfaction with the document, alignment, that would be good. But if we want something deeper, if we want those lived experiences and those narratives to come out, I think these kinds of stakeholder summits are really valuable.
So it's interesting. I started to grin and giggle a little bit because, you know, when Virginia got its first federal grant, it was for a needs and resources assessment. And we did 19 town hall meetings across the state. We went, and then like a year later, we went back and we said, this is what we've been hearing, validate it or don't validate it for us. And as Kara said, the narratives that you get are incredible. And we used so many of those quotes for many, many years. And one I remember very clearly is, you know, in my accident, I hit a telephone pole. Everybody knew what to do with the telephone pole in the car, but nobody knew what to do with me. You know, and that's just a great little quote. And those things, I mean, yes, oh my Lord, what a heavy lift, and 19 of them. But they were great, and people were so grateful. We couldn't get out of there because everybody wanted to stop us in the parking lot and either tell us the story that they didn't get a chance or tell us how grateful they were that they felt listened to. And you know, I sort of had forgotten that we had surveyed everybody for the priorities letter, and I like the idea. You know, I think that perhaps virtual listening sessions, you know, may not be quite the heavy load that they could be if we were traveling to, you know, 9 different locations across the state. So that's an interesting thought.
There may also
Just
be
so you guys are aware. No, I'm sorry, Kara. Just so you're aware, Victoria has joined the call now.
Oh,
Okay.
good. Hi, Victoria.
What were you getting ready to say, Kara?
Oh, I was going to say that there may be some pre-existing forums where we could, you know, gather some of these narratives. So there might be some, if we talk to the Alliance, there might be some caregiving forums or support groups or member groups or things that already are happening virtually that we might tap into. Just a thought.
Well, you know, the other thing that I'm thinking about, and I guess this is a question, I'm assuming that listening tours would also be considered to be public meetings and would have to be handled in the same sort of way. And there have been, go ahead.
I don't know for sure, Anne. The rules apply to council and board meetings, so I don't know if listening sessions, by their very nature, we would have to ask. We want them to be interactive. George, do you have a sense of that under these rules? Of course, once we get out of the emergency declaration, then all bets are off. So,
Right.
But George, what do you think?
Yeah. So they were. We did take minutes and post them, but obviously they were in person, so it wasn't. We didn't have the recording and the captioning and all that. But yes, they would be considered public meetings, I would think.
Okay.
What if these were considered sort of part of an assessment or research study? So I'm thinking about like when we get IRB approval for an assessment or research study that protects confidentiality and preserves privacy. So, the spaces would be rendered private versus public. I'm thinking more about the participants, less about us and the logistics, but more about the safety of participants sharing their narrative and their feelings. What might that be like if they're thinking, oh my gosh, my medical doctor could be watching this right now, or
That's a great point.
the head of the MCO could be watching this right now, and I can't say what I really want to say.
That's a really good.
Yeah, you might,
It's a really good point.
Chris,
Go ahead,
you
John.
might want to talk to, can't remember her name right now, who does the independent living plan.
Oh, to
Lauren.
Lauren. Okay.
Yeah, talk to Lauren, because she just did this last year. And I think,
Okay.
so in our minutes, we didn't necessarily identify people by name. And we didn't actually, I think I only received one comment by email over the listening period, so.
Well, I think what we're talking about is the difference between going to a place in person and talking within a group versus it being broadcast and stored where people. So
Yes.
let me do a little talk with policy to find out what the rules would be around that.
That'd be great. Okay. Well, then let's approach this, and we'll pin this down when we talk in January, as a conversation on the general goals of the plan. And we'll give them an update about what we're doing and what we're thinking about, relative to, we talked about listening tours and, hey, it's a great idea and we're going to make it work this way. Or we talked about listening tours and we have some concerns and Chris did some digging and this is where we are with it. And then sort of see where that goes. And then we'll know better whether or not we think we may need to do something like that or can just build on the feedback that we get from the council on the general goals at the January meeting and provide something at the April meeting that may be firmed up. If the listening tour is not something that seems to be feasible, then perhaps we can assess where we are in April as to whether or not that could be something that would be done in person later on, or whether we want to send out the plan tweaked based on the comments that we get from the council in January. Take it back to them in April, tighter plan, and then send that plan out for public comment like the Alzheimer's Commission did. Did I describe what I have in my head clearly enough for everybody? Do I need to do that again? Okay.
No, you did good.
Okay. Well, we've got just a little, just about 20 minutes left, and I wanted to be able to give some feedback to Chris for her consideration about the state plan. So I'm happy to have folks just sort of weigh in generally. I can call on each of us and we can each get a couple of minutes to sort of share some of our thoughts, or we can go through it goal by goal. What would feel better for the members of the committee in terms of providing Chris some feedback?
I'd be happy to be called on.
Okay, well then George, you go first.
I knew that was going to put me on the spot. So as I said, I think it's a really great start. But I so I had a number of thoughts as I was reading this. One is, I guess my first point is that maybe there are too many goals, and that some of them can be usefully combined or changed. So, for example, goal one, absolutely. So I thought maybe goal one and goal two could be combined potentially, because you've got services and supports and housing for brain injury people living with brain injury. Not necessary, but it did seem like that might be one way to go. Goal 4, I felt like this could be training more broadly. So not just caregivers, but because it seems to focus a bit on training caregivers, but then there's also some training under goal 2. There was some training and support for the Medicaid folks.
Donna, would you mind putting up the document again and just showing the
I'm
top
sorry.
where it's got, just show the top where it's got the list of the goals. Okay. I'm sorry, George, keep going.
Okay, so goal 4, maybe training more broadly to include providers and workforce training. And goal 5, I kind of felt like this was a redundant goal. So the first 2 bullets really apply only to the council. So maybe they should be something in its mission statement rather than in the state plan. Bullet 3 there, which was the peer support and recovery, is already in goal 3. And the last one on self-advocacy is partly in goal 4 already. And then again, bullet 4, I thought was maybe a task for the brain injury unit or a committee within the council rather than necessarily to include in the state plan. So I felt like that last goal was a little bit catch-all that maybe didn't belong in the state plan necessarily. And the other big comment I have was I think it needs some explicit person-centered language. So it's implied, but it's not explicit. And I had some smaller comments, but I won't go into those now, unless you'd like me to.
Well, I don't know, George, if you took the time to, write any of those comments into a document, and maybe we could encourage, if any of us did do that, we could send our comment documents to Chris so that she could go through it, because certainly that's what I did, and Laura has made some comments. So if you've taken the time to, maybe do a track changes or something like that, if you have that, please send that to Chris. I think she'd find that helpful. Yes, you nodded your head vigorously at the beginning, Chris.
Yes, definitely. And in
I've
any
done
format,
that.
track changes, just a list, anything that works for you. Thank
Okay.
you.
Yep, I'm happy to do that. I've got a track changes document. So.
Kara, do you have any thoughts that you'd like to share?
Yeah, I would echo some of the things that George said. I think that there might be an opportunity to collapse or integrate some of the goals. I felt a little out of my element in really diving into the objectives, because some of the things I'm not familiar with the landscape. And I actually noted that it might be helpful to footnote or create endnotes for language that a reader like me, somebody who's a little bit more external, would understand. So for instance, I don't know what a self-advocate is, the capitalized S and then capitalized A. So it could be helpful to footnote that and provide a reference. And, similarly, the sort of Medicaid MCOs, that might just be footnoted so that the reader understands like why that particular grouping or entity. The other thing that I noted, and this is a little bit more editorial, is that some of the objectives are double-barreled. So they actually are almost like 2 objectives in one. And I would say it would be important to split them out, because it's really hard to measure or show progress when something is double-barreled. So for instance, expanding access to community-based services, we might want to separate that from eliminate waiting lists for community-based services. Or maybe eliminating the waiting list is actually the action that meets the objective. So, there's some pieces where there's just too much kind of going on in the sentence. The ones that I looked at most closely were goal 3 and goal 4, just because that's closer to kind of my area of connection or my own research interests. And I felt that they were pretty inclusive of conversations that we've been having and the priorities letters and, things that we've been talking about over the past 5 or 6 years. So I appreciate you capturing all of that work too. So I think that's about it.
Victoria, are you comfortable weighing in?
Yeah. I kind of feel the same way that Kara and George feel on some of the objectives. The thing that kind of strikes me right now, just based on my own personal experience, is just how important housing is. It's a really big deal. I've had conversations with Access Independence in my area, and it continues to be an area that's on the top of the list. So I'm glad it's there because it's something that needs to be addressed. But I'm not sure if that's sort of like a subcategory to, having more access and, not having, the waiting list or, really how to approach it, because it seems to be a common area of concern that's been ongoing for a while. I do have some notes that I can share based on the list, but the thing that I was really thinking a lot about is just the importance of access, and also not just that, but the training piece and the caregivers is it's really important, because caregivers feel like they're in a fight constantly, and having the ability to help them relieve some of that pressure and help with the communication, not just with survivors, but with providers, is a really good thing. So I'm glad that's on the list too. So from a survivor perspective, I like the direction everything's going in. I think it's at a good point for refinement, which is pretty much what we're doing now. So no, I think it's great.
Thanks, Victoria. Great input. I like the comment on the supporting caregivers, not just with their at-home stressors, but learning the system and how to navigate it. Important point.
And I'd echo the glossary idea. So the Dementia State Plan has like a 2-page glossary with Medicaid terms and all these kinds of things, because I didn't know what a self-advocate is either, capitalized. So those were some of my comments, but I think a glossary is a great idea.
Okay, I'm taking a number of notes, so hang on a second. There we go. I'll just, Chris, I'll send you a document that has some really specific comments from Laura and I. And I'll just talk sort of generally about a couple of things that I brought up. There were a couple of things in here that I wasn't even sure about what you meant. And, this is what I do every day. So I do think that there are things that, that because we get in our own heads, we tie ourselves up sometimes with some of this. I'm trying to, like the peer recovery systems stuff. I'm not terribly familiar with that. And I know that it's a prominent model in behavioral health. And I wasn't sure if you were thinking about, we're going to sort of tap onto theirs or replicate it for brain injury, or we're going to try to get brain injury in their peer recovery things, because that's sort of like oil and water in some ways. Our acceptance in the behavioral health community and within the CSBs. So that was one of the things. I think that, you know, in terms of comment one, there were a couple of things that I felt like we were missing. We don't have anything in this plan related to the educational system for kids, for young adults, and you know, for parents or for teachers. We don't have anything in here related to mild brain injury. It may be that there's the services and supports, but those are very rarely, you know, long-term. They're more transient in nature. But as the state plan for brain injury, these are groups that have to be included, whether or not they are disabled as a result of brain injury, which, you know, sometimes this gets us into this back and forth thing with DARS. There's nothing in here related to sort of information and referral and registry outreach. I think eliminating wait lists is something that will never happen. So, you know, I think we can talk about, you know, working to continually control it or reduce it or something, but, you know, yeah. I had some questions, a few other things that were specific in here about what do you mean by brain injury certification? Are you talking about the state funded programs, which is one thing, because if you're talking about hospitals, you know, that's a whole nother sort of thing there. And with the community colleges, were we talking about young adults attending community colleges and supports? Are we talking about for the people who work in the community college system, creating more brain injury friendly disability programs? So, you know, there are a number of things in here that I think may be in a larger plan, a little too weedy. You know, I think we can have some ideas in the back of our head, but there may be a few things that trying to explain them would eat up some valuable space, not only in terms of time, but in how much people can take in and understand, and, you know, some of that sort of thing. I think that, you know, one of the points that I made was in goal number 3 in terms of crisis intervention, where it says collaborate with state and local crisis intervention team programs to prevent hospitalization and arrest of individuals living with brain injuries in crisis. And in the vast majority of the neurobehavioral cases that we know of, the justice system is not involved. You know, these are folks that, you know, can't, like the kid that got dumped on the doorstep of St. Mary's and lived there for 6 months because they couldn't find a nursing home to take him. There's no justice system involvement. So that may need to be, you know, sort of tweaked out a little bit. In goal number 4, I thought I'd really like to see a goal to increase the representation of family caregivers on boards and councils, unless we consider caregivers to be people with lived experience, because they have their own lived experience, and that terminology could work if we include caregivers in that. And then one of the things that I noticed is that there's really nothing in here about increasing public awareness, which when you talk to folks comes up all the time. They want more people to understand. They want to be able to go to a doctor that understands something about it. They don't want to have to explain it to every person that they come in contact with. They'd like people to understand why they can have a good day one day and a really bad day the next, and not be, you know, feeling like they're constantly under a Sisyphean sort of, you know, burden, always pushing that brain injury ball up the hill because nobody ever understands it. So those were just a couple of comments that I had. So Chris and everybody on the committee, if you have any written comments, please go ahead and share that with Chris. I think that will be helpful for her. We'll talk next month. Chris is going to do a little bit of investigating on the whole idea of a listening tour, and we're going to think that through a little bit more. We will plan at this point to have a conversation about the goals generally. So we'll probably work on these goals, I'm imagining, over the next month and see if we can't tweak those. So we'll confirm that those are the goals that we'd like to discuss. And I think at that point we can also discuss other information that we would like to convey. What do we need to set up the conversation? What context may we need to provide? Who wants to do different parts of it? And that sort of conversation. Is there something that I am missing that we will need to discuss between now and the council meeting that needs to be included as part of our January call?
I guess we just need to schedule enough in advance to get any prep materials out, right?
Mm-hmm.
Yeah.
And would you like me to then tweak the goals based on the feedback from today's discussion as well as what you all send me?
Yeah, I mean, I think, Chris, if you have a couple of different ideas that we could respond to, and then we may be able to help you narrow that down, you know. How does that sound? So if we want to look in enough time to get the information out, our next council meeting would be, correct me if I'm wrong here, the 22nd of January.
Yes.
So in trying to get these things out in 2 weeks, we'd have to meet sometime that very first week of January. Can everybody look at their calendar and see, would you be available to meet on Tuesday or Thursday morning?
The 5th or the 7th?
The 5th or the 7th, yes, ma'am.
I could do the 5th. If it's the 7th, it just needs to be late morning, like after 10.
Okay. George and Victoria, would you be available for 10 o'clock on the 5th?
This is Victoria. I'm open on both days.
George, I was looking at my calendar. Did you nod your head? Or are you still looking? Okay. So let's plan on January 5th at 10 o'clock. We will look at the goals and determine how we'll proceed with the conversation around the goals. We will discuss any information that needs to be provided in context for the conversation and the information that we want to convey about our work so far and future plans. Anything else for that part of the agenda? Okay, it's 11 o'clock. I'd hope to say, is there anything that anybody has to say that we did not talk about today regarding this process? Okay. Victoria, I can't see you, but I'm getting head shakes too. There's nothing else left to say. So.
Oh, yeah, sorry.
That's okay. That's okay.
I'm good too.
That's okay.
Weird being on the phone.
Well, then we have a plan. We'll send out a meeting invitation for the 5th. And don't forget to share your feedback with Chris. And we will be talking sometime early January to have something to send out to council members for the January 22nd meeting. It's coming along nicely, folks. Thank you very, very much for your thoughtful comments and considerations. This is, it's good. It's good.
Great discussion. I really appreciate it.
Take care, everyone. Bye-bye.
Have a great
Thank
day.
you.
Bye.
Bye-bye.